Functional medicine is the future of healthcare. No longer will doctors just be looking to cover up or manage symptoms. The future of health is getting to the root cause of disease and fixing the underlying problem. Hi, I'm Dr. Mortensen. The type of healthcare that we practice is different from most other doctors. We look to restore health and balance to each person on an individual basis. Our approach to health is through personalized lifestyle medicine, with the goal of optimizing function and restoring balance. Each patient's health is an expression of the individual's genetics, environment, and behaviors. By looking at those three main areas for each person as an individual, we can get a more complete picture of why someone's health may be poor or deteriorating. Our goal is to remove the triggers of disease, whether it's toxins, infections, allergens, poor diet, stress, malnutrition, or any number of different issues. If we can remove those underlying causes, you can get back to health. Some people may be genetically predisposed to breast cancer, colon cancer, autoimmune diseases, mental mood disorders such as depression or anxiety. But we're not solely an expression of our genes. Why does one person with a genetic mutation get a disease while another person does not? It's because the expression of our genes is influenced by our environment and our behaviors. There is a saying many functional medicine doctors like to use, which is, genetics loads the gun, environment pulls the trigger. How we live our lives will determine our genetic expression. Functional medicine is a culmination of the latest evidence-based research, combined with the most advanced laboratory and functional testing available. We use this information combined with your genetic predispositions, environmental factors, and your behaviors to view patients as a system rather than an isolated set of symptoms and treat the underlying cause of disease. We look at what processes in the body are working and which ones are not. We look at these and figure out how these malfunctions can be influencing your health. We're taught from an early age that kids sing along song, dem bones. The leg bone is connected to the hip bone, etc. The entire body is connected, yet our doctors continue to get more and more specialized to one particular area of the body. They tend to forget how function in one area of the body influences function in another. Doctors often become so focused that they lose focus of the patient. These specialties have nothing to do with how the body is organized. This narrowly focused approach often leads to the pill for an ill type of healthcare. Each symptom gets a medication to cover up the problem. Many times I have patients come in to see me that have multiple symptoms. Maybe they have a runny nose, achy hands, headaches, upset stomach, and depression. They come in for their first appointment and they bring a laundry list of medications that they take along with pages of notes from every different doctor they're seeing. They're seeing an allergist for the nose, a rheumatologist for the hands, a neurologist, internist, psychologist, all kind of ologist doctors. Each one treats a different area. No one has taken the time to sit down with this patient, fully analyze why they have different problems, and get to the root cause. Functional medicine looks to connect those dots to find the cause of underlying disease. We recognize that the causes and cures for each patient's condition is different. The types of testing we do varies from person to person. Based on each person's history and exam findings, we will sit down and go over the different recommendations for testing. The test may be genetic testing to see if you're predisposed to certain issues. You might do blood tests, serum, saliva, urine, stool, hair analysis, or other functional tests to determine the level of functioning of your body. Each person is different. No two patients will get the same tests or the same treatment. This is personalized, natural lifestyle medicine. The treatment we provide in our office is integrative, natural, evidence-based care. This includes recommendations in lifestyle, vitamins, herbs, supplements, cleanses, acupuncture, chiropractic, massage, and many other modalities. The distinction in our office is that we take an evidence-based approach. This means that we painstakingly research and analyze everything we do and recommend. If there is little to no research or science behind a particular procedure or product, most likely we will use it. The beauty of integrative functional medicine is that it is a whole systems approach to the body and health. As such, we can treat a huge range of conditions, from autoimmune diseases like MS, lupus, Hashimoto's, to digestive diseases, mood disorders like depression and anxiety, thyroid issues, adrenal fatigue, hormone imbalances, autism, obesity, hypertension, and many others. Because of the type of approach to health we take, there aren't many conditions that we can't help. We also do a ton of anti-aging, or what I like to call well-aging patients. We obviously are not going to stop aging, but we can influence the rate and how we age. It's not often about just how long we live, but how well we live when we are alive. If you've been seeing doctor after doctor and can't find the answers or solutions to your health issues, if you're on a bunch of medications you're sick of taking, paying for, and having the side effects from, if you're just sick and tired of being sick and tired, then you're ready for and need a different approach. That approach is integrative functional medicine. We can help you restore your health and give you hope.